Good morning. I'm Dr. Marilyn Goski, and I'm a pediatric radiologist at Cincinnati Children's. I'm also the chair of the Image Gently campaign, and I'm really so happy to talk to you about communicating with parents about radiation use in diagnostic radiology. Next slide. And the two things that we're going to talk about are why it's important to communicate with parents about radiation protection for children. And second, we're going to discuss how to communicate with parents regarding this issue. I think many of you on this next slide have seen this headline from USA Today. It says, CT scans in children linked to cancer later. It doesn't say maybe or possibly. It really looks like a definite fact. And this is what parents are seeing in the media. Next slide. They may have seen this slide that shows a child who had a CT scan of the neck over at least 100 times, and it actually shows the deterministic effects that you can see almost immediately from skin burns on this child's face. Another article in the New York Times was another medical error that occurred in a large academic hospital here in California. And this is a situation, another deterministic effect, where CT scan performed to evaluate for possible stroke resulted in hair loss in an unusual band around the patient's head. So I think one of the things, next slide, that I want to really emphasize is how parents need balanced information. Next slide. Another point that I'd like to make is that when you're communicating risk with parents, we really want to think about this as an estimated risk. And I think this relates then to this next slide. Why is radiation such a difficult topic to discuss? Next slide. Radiation is difficult because we really can't see radiation. Next. We can't measure it. Next. Its effect can take years, and 40% of all U.S. citizens will get cancer during their lifetime. If you think about on this next slide how medical radiation is really invisible, and this fact makes it even more difficult to talk about. Next slide. In the United States, we have a baseline cancer risk of about 40%. 4 out of every 10 people that are either watching this or sitting here will get cancer during their lifetime. And for about 2 out of 10 of those, this will be fatal. Part of the reason why this is such a difficult concept to relay to parents is this idea is we're talking about population statistics. Next slide. Let me give you an example. This was taken from an article that actually was talking about a nuclear medicine bone scan in a 10-year-old and trying to convey to parents this idea of estimated risk. There are actually 2,500 little circles on this slide, and you can see that some are a darker blue, and this relates to that 40% baseline cancer risk. And then you see this one little star here that's trying to convey the possibility that there may be an increase in cancer for this one patient. But again, I think that, next slide, there's a problem with that last slide because again, I think it tends to convey that if you did scans on that many patients, it's certain that one of them will get cancer, when in fact, none of them may get cancer, or if you had another 2,500 patients, several of them may get cancer. So this is a very complicated area for not only parents, but also medical professionals to get a handle on. This is an area of great controversy. Next slide. There's been several excellent white papers that talk about how to manage radiation dose and the challenges related to this. And I think we need to know that there is controversy in this area, that Hall and Brenner felt quite strongly that there will be an increase in estimated cancer risk in the U.S. population, whereas Ruben Mesrick in another article talked about how you can't really equate an atomic bomb with a very specific CT exam over a specific part of the body. And yet we know, as other speakers have talked about, that there is overlap in the radiation doses that the atomic bomb survivors receive, and they do overlap with some of the doses that we can see in CT. Parents will often ask, next slide, what is the radiation dose that my child received? And we really, until recently, had no specific way to answer this question. Now that we have size-specific dose estimate, which is an estimate within about 10 to 20%, it now is easier to calculate estimated dose for parents and give them a little bit more idea of what radiation dose their child received. Next slide. So we're really grateful to the medical physicists who worked together to come up with this estimated dose. And it really is just it's not perfect, but it's an intermediate method before we're actually able to calculate organ doses, and I believe it's a huge advantage for patients. The next thing that we mentioned on the next slide is you can see that the potential effects may take years. And the effects may not be manifest until 10 to 40 years later. And part of this effect that has been well described is also coupled with the fact that children are more radiosensitive. Next slide. So now that we have a few background things that we've mentioned, next slide, I'd like to go over how to communicate with parents about medical radiation. It really is, on this next slide you can see, our responsibility to educate not only ourselves but the public about radiation protection for children. And one of the things that I think many of us don't realize is that the average reading level in the United States is 8th grade, and that comprehension level, the ability to understand that material, is actually 2 grade levels below that, so the 6th grade level. So when we're talking about something like radiation risk, it can be very difficult for folks in the general population to understand this. Next slide. This next slide shows that the Institute of Medicine came out with a wonderful report that talks about how 90 million people in the United States have difficulty understanding different concepts within their healthcare and have difficulty acting upon that information. Next slide. So what we want to do is when we talk to parents or we create brochures and stuff, we want to be truthful, but we don't want to be alarmist. We want to empower parents to ask specific questions. We in Image Gently have not used atomic bomb pictures or ulcers or skin deformities, but we do want to be truthful with parents so that they understand and have some sense of the discussion of radiation risk in children. We tend to also try to qualify and say, rather than saying 1 in 1,000 will get cancer, say things like there's a possibility or there's increased risk. And I think that that's accurate, but also is helpful for parents in this discussion. Next slide. One of the reasons that Image Gently has taken this approach is that there's something that we know from the psychological literature. And it tells us that patients and parents are biased. They want to take a difficult concept and try to make it more simplistic. Something is either black or white. CT is either good or it's bad. And we really all agree that we don't want parents to refuse indicated exams for that child. And this paper by David Larson et al. Did just a simple parent survey. They gave parents a simple brochure that I'll show you in a minute, and they found out that prior to giving the brochure, that only 66% of parents were aware that radiation was used for the scan. 99% were aware after. They also found out that 13%, only 13%, were aware of the potential increase for cancer, whereas by the end of the study, 86% were. The other important point is that no parent refused the scan. And I think that really plays to the fact that parents really like additional information. And this is the simple brochure on this next slide that you can see that really informed parents. So it doesn't take anything complicated. Next slide. So another interesting point is talking about informed consent. And it was shown in this older piece of literature that only 15% of departments were informing adult patients about radiation risk prior to CT. Next slide. But there are many of us who believe that rather than doing informed consent, which may just be a legal hoop to jump through, that we can actually do something more that's interactive with patients, and that's called informed decision making. And what that does is it allows parents and patients to really read information and then ask questions so that those questions are answered before the test. Next slide. A question that many of us get is, how safe is CT scanning for my child? Next slide. And we can get back to that idea when we talk to parents about the fact that there's a benefit and risk. And you want to make sure that the parents understand what that risk might be. We've known from talking to families, on this next slide you can see, should I let my child have the CT or not? And I think we should subtitle this question is, am I a good parent if I let the child have the CT scan, or a bad parent if I let them have the test? And so on this next slide, what I wanted to do is provide you with some talking points. I think one of the first things is to thank a parent for asking the question and acknowledge the fact that you may not be the person that can decide whether or not their child has the scan, but we can also say that we can talk to them a little bit about X-ray and CT. I think it's also important to ask the parents why their child is going to have the scan, because it kind of reminds them that there is a reason why they brought their child to the hospital. And you also want to find out whether or not they got any background information about why their doctor was requesting this study. And then you can go on and talk to the parents about this. And on the next slide, talk about CT scans that give a lot of information to parents. And we can also reassure parents if, in fact, the hospital has child-sized their radiation dose. We can also talk about the fact on this next slide that the facility and the medical professionals have done some significant work in trying to make their scanners safe, and that's getting ACR accreditation, getting their technologists registered in CT, providing them with a brochure, and if the parent continues to have questions, the radiologist could answer those questions again. And you in your institution, on this next slide, it reminds you that you may want to come up with some uniform talking points among your own institution. And this next slide is animated, and we need to acknowledge parents' concern. And if initially the parents are not interested in talking about it, next click. And you can see next click, you can see next click. Finally, the technologist is saying, can we discuss this some more? And we want to emphasize with the parents that this is something we're interested in answering their questions. On this next slide, you can see from a online blog about how a parent is saying that they felt that they were angry, actually, that there should be a change in policy, that parents should be informed about some of these information about radiation risk actually before the scan is done and not afterwards. So on this next slide, we can see that the message should be positive, it should be simple, it should be short, there should be action words, and a truthful, realistic discussion of risk. And on this next slide, this is really the philosophy that Image Gently has used. Does radiation in medical imaging cause cancer? Next click. We don't know, but we should act cautiously as if there's a risk. And what that does is it puts aside all of the controversy and focuses on performing the low dose or lower dose studies that are child-sized. Very quickly, on this next slide, you can see that we have these resources, the smart card that has launched by the IAEA, and the medical imaging record card that is on the Image Gently website that parents can use to track their children's studies. And if you notice, we don't put estimated dose in there. It's simply a method for parents to record the place, the date, and the name of the exam. Next slide. So now I'm going to talk a little bit about some resources that are available. Next slide. And the first is the Image Gently website. We have a tremendous amount of information with a specific parent tab. We have a lot of brochures that are free. All you need is a color printer. You can download those. There's 8 CT modules that don't cost anything that your technologist can take with a certificate at the end that can be collected to document that there has been increased education regarding pediatric CT. There's also a practice quality improvement module that radiologists can take and get maintenance of certification credit from the American Board of Radiology. Image Wisely has a tremendous amount of information, particularly on this next slide, related to equipment and information provided by manufacturers. Next slide, another wonderful site is radiologyinfo.org, sponsored by RSNA and ACR. There's even some video clips, and it really talks about the procedures, which many patients have as a question. On this next slide, you can see a wonderful site called Radiation Protection of Patients, RPOP, sponsored by the International Atomic Energy. Wonderful references for patients to look up. On this next slide, we actually have a video clip that I'd like to show that was sponsored by the American College of Radiology. That is a public service announcement. If we could play that now.
Okay, honey, go play. My son needed a medical imaging exam, but talk of radiation made me a little concerned. So I asked our doctor, how will this exam improve his care? Are there alternative tests that don't use radiation? Is the facility accredited for quality and safety? And will he receive a child-sized radiation dose? Our doctor told me, if you need a scan, the benefits outweigh any risk.
If you're concerned about radiation, ask your doctor and get the facts at imagegently.org.
Our next slide shows what we've done at Cincinnati in trying to inform parents In addition to putting these brochures in different physicians' office, we have a kiosk that parents can look at, as well as having the brochures actually printed out and in our waiting room. Next slide. So until technology is available that replaces medical radiation, we really need to be sure that parents, families, referring physicians, and the entire radiology community have accurate and common information. I thank you very much for listening and look forward to answering any of your questions. Thank you.